Welcome back to our channel, where we explore topics related to mental health and well-being. Today, we're diving into a fascinating subject, ADHD in women versus men. Does gender play a role in the symptoms? Let's find out. Disclaimer: this is an educational video prepared by physicians with the intention of understanding the complexities of health and diseases, and in no way intended to criticize or hurt any person, company, or segment of the community. The discussions in the video are backed by sound scientific evidence which can be referred to the literature for better understanding. The focus is on understanding health and diseases in a way that is helpful to patients, healthcare providers, and the common man, which often gets lost in translation in the current popular media culture. Attention Deficit Hyperactivity Disorder, or ADHD, affects individuals of all gender identities. However, it's important to recognize that ADHD can impact women and men differently. While it may appear that ADHD is more common in males, females are often underdiagnosed or misdiagnosed due to differences in symptoms. Today, we'll be exploring these gender differences and shedding light on the unique experiences of females with ADHD compared to males. Let's start by addressing the prevalence of ADHD in women versus men. Now, this can be a bit tricky. According to the Centers for Disease Control and Prevention, CDC, 12.9% of men and boys live with ADHD, while 5.6% of women and girls are affected. However, it's important to note that women and girls may be impacted more than these statistics suggest. ADHD is just as prevalent in girls, but it is often underdiagnosed due to different factors. Cultural and gender biases and expectations can contribute to the disparity in diagnosis rates between boys and girls. It's clear that societal factors can influence the diagnosis and recognition of ADHD in women and girls. So, let's explore the diagnosis process further. When it comes to diagnosis, boys and men are more likely to be referred for services, even when their symptom profiles are exactly the same. A 2019 study suggests that ADHD diagnosis may be more easily missed among females during the diagnostic process. Females are also less likely to be prescribed medication and receive a diagnosis because they don't typically display the disruptive external symptoms associated with ADHD. It's crucial to understand that the diagnosis process can be complex, especially for adults. Factors like comorbidities, trauma, and medical conditions need to be taken into consideration. Further, females tend to be more subtle and less aggressive in the social context, whereby typical symptoms of ADHD are often overlooked by the physicians as they do not fit into the typical profile seen in the male counterparts. These girls, unfortunately, grow up without a proper diagnosis and have identical problems with as adults, but are often misdiagnosed into psychiatric or psychological conditions like depression, anxiety, and bipolar disorders due to a lack of awareness among both parents and care providers. The current treatment guidelines are very different for ADHD when compared to the above-mentioned mental disorders, as ADHD can be controlled through behavioral modifications, but the mainstay of treatment for the latter conditions is medical management with medications with a lot of adverse effects. Seeking a thorough evaluation from a mental or medical health professional is essential. Now, let's talk about the age of onset for ADHD symptoms. Research indicates that symptoms typically manifest before the age of 12, but they can even appear as early as 2 to 3 years old. Boys tend to show an earlier onset than girls due to differences in symptom presentation. ADHD is a lifelong neurodevelopmental condition. While people don't grow out of it, early diagnosis and proper treatment can significantly impact symptom presentation over time. It's worth noting that hormonal changes during different stages of life, such as puberty, the monthly menstrual cycle, perimenopause, and menopause, can influence the intensity and presentation of ADHD symptoms. Now, let's delve into how ADHD symptoms differ between the genders. Women and girls with ADHD often exhibit internalized symptoms, such as overthinking, intrusive thoughts, and negative self-talk. Other symptoms may include maladaptive daydreaming, anxiety, depression, and difficulty maintaining focus. Additionally, they may experience auditory processing disorders, forgetfulness, and various physical and emotional challenges. Females often are not very expressive in matters of dominant behavior patterns during peer interactions and often tend to perform well in academics as they naturally have the ability to control impulsiveness. Subtle symptoms like a lack of self-confidence, feeling of worthlessness and inability to cope up with peer pressure may be present but are often missed due to the cultural upbringing and gender biases seen in different geographical regions. This may end up with a lack of self-esteem in these individuals who end up tolerating abusive relationships, becoming obsessed with external appearances and not reaching out for help when in trouble. On the other hand, men and boys with ADHD tend to display more external behaviors, including hyperactivity, disruptive behavior, and difficulty with impulse control. They may struggle with losing items, interrupting others during conversations, and engaging in high-risk behaviors. Males often underachieve in academics, but this often masked by their ability to perform well in sports and extracurricular activities which are often glorified by their peers and school environment, whereby they are able to focus their extra energy into something productive. The unfortunate ones who do not find their calling in these developmental years end up with significant oppositional developmental disorders whereby they end up with significant difficulties in social, civic, and work domains. The obvious intervention for ADHD is the ability to learn coping mechanisms against impulsivity, and to do this a lot of effort needs to be put into understanding the condition and working towards better outcomes. Resilience happens to be the key word in behavior-related or recurring conditions where the ability of the individual to get the better of the ailment is the key in coping up with the effects of these conditions. Cognitive behavior therapy, unlearning of biases, relearning of the correct coping skills and a team approach involving the individual, family, friends, and healthcare professionals needs to be the standard approach for better patient outcomes. To recap, people of different genders experience ADHD in unique ways. While women and girls often demonstrate internalized symptoms, men and boys tend to exhibit more external behaviors. It's important to remember that these differences arise from structural and functional variations in the male and female brain. While we've gained some insights into the gender differences in ADHD symptoms, it's essential to acknowledge that further research is needed. Increased education, removal of stigma, and improved treatment options are necessary to support individuals living with ADHD, regardless of their age or gender. If you resonate with any of the symptoms discussed today or are curious about ADHD and its impact on your life, consider reaching out to a therapist who specializes in this area. Remember, an early diagnosis can lead to prevention of future complications, but the ultimate goal is to improve the quality of life and provide emotional freedom to be our true selves. If you found this video helpful, don't forget to give it a thumbs up and subscribe to our channel for more informative content. And as always, take care of yourself and each other. See you next time.